Today we are going to talk about another clinical case. A 59-year-old man with no prior medical history presents to his physician with marked hyperglycemia, diarrhea, and weight loss. CT of the abdomen reveals a pancreatic mass. A trial period of an oral hypoglycemic agent has not succeeded in reducing his glucose levels. Physical examination is significant for the painful rash shown in this image. Which of the following is the most likely diagnosis? Glucagonoma, insulinoma, pancreatic adenocarcinoma, type 1 diabetes mellitus, or lipoma. So, it is a pathology related to the pancreas, where usually most of the pathology is related to are either hyperglycemia, either hypoglycemia, or so in some condition there will be destruction that leads to increase in the lipase and amylase levels. Okay. So they are talking about some pathology of the pancreas that leads to the symptoms like hyperglycemia, diabetes, or diarrhea, weight loss, and this dermatitis. So if you want to rule out so in case of lipoma, in case of diabetes mellitus type 1, in case of pancreatic adenocarcinoma, in case of insulinoma, we cannot see dermatitis. Okay, so we can just pick out that the answer is glucagonoma. But if you don't know that in case of glucagonoma, there will be either we can see dermatitis or not, or what type of dermatitis is this as shown in this image. So for that we need to go for the triad or for special science that will help you in identifying that which type of pathology is this. Okay, or is related to that of the glucagonoma. Okay, so first we will go through the pathologies one by one. Okay, so they're asking about, they said, if you compare about, if you study the glucagonoma, the symptoms of glucagonoma, there will be 5Ds. Okay, you need to remember the 5Ds. Number first is diabetes or hyperglycemia. Number second, the dermatitis, that is migrating necrolytic. So when the dermatitis will be necrolytic, they will be painful, as they shown in this image. And already mentioned that the dermatitis in this patient is painful dermatitis. There will be deep venous thrombosis. There will be depression and diarrhea. So we have dermatitis given in this image, dementia or diabetes that is given in this question, hyperglycemia, and diarrhea. So we can say that our answer could be glucagonoma. So let's see the other options. Vipoma. So whenever the term vipoma, you will you need to remember watery diarrhea, achlorhydria, hypokalemia, flushings, and muscle weakness. It's a type of neuroendocrine tumor. So it is also called as the pancreatic cholera, because cholera is a bacterial infection that leads to watery diarrhea and that leads to severe dehydration. So dehydration we can also see in case of lipoma. So it has some quite similarities with that of the cholera. That's why it is pancreatic. It is called as pancreatic cholera, as the origin is pancreas. So it is called as the pancreatic cholera. So there will be watery or secretory diarrhea, achlorhydria, because the lipoma, the VIP inhibit the gastrin secretion. Once there will be less or no gastrin, there will be deficiency of the HCl production. There will be hypokalemia, there will be flushings and muscle weakness. In case of insulinoma, everybody know about insulinoma, that it is the excessive production of insulin in equal amount of the C-peptides. So there will be hypoglycemia, dizziness, sweating, tremor, weight gain, and palpitations, and many other symptoms as well. But you need to remember this. In case of diabetes mellitus, there will be, hyperglycemia, polyuria, polydipsia, polyphagia, blurring vision, because in later stages there will be destruction or damage of the endothelial cell of the microvasculature, and vaginal infection, urinary tract infections. So they are all associated with diabetes mellitus. And if you talk about the pancreatic adenocarcinoma, so it is usually appear at the head of pancreas most commonly, and it is the tumor of exocrine glands. It can cause the destruction of the cells in the pancreas that leads to hyperglycemia as well. And as you know, the bile duct and the common bile duct and pancreatic duct joint, so it can cause obstruction. Okay, so that cause obstructive jaundice. So there will be jaundice, obstructive, abdominal pain, the radius big, hyperglycemia because of destruction of the cells, weight loss as it is a tumor, dark urine, and pale stool because of the obstructive jaundice. So if you compare all the pathologies given in this question and want to see that which pathology has similarities with that of the question, so we will go for the glucagonoma, because they have said there will be diabetes, dermatitis, and diarrhea. Okay, so we will choose our option according to the symptoms given: hyperglycemia, diarrhea, weight loss, and necrolytic dermatitis. And once more, there will be the oral hypoglycemic agent. They are not having much effect because it is not a pathology related to the enough or decreased production of the insulin, because oral hypoglycemic agent they causes either increasing the increasing the insulin level, or they increases the sensitivity of the peripheral receptors to the glucose. And in these agents usually works in case of diabetic mellitus, not much in case of glucagonoma. Okay, so we will go for the answer. The answer of this question is glucagonoma. Thank you very much.